folks who may or may not be familiar with it. So I'll go ahead and introduce our lecture series today. The Climate Changes Health and Health Equity lecture series began in the fall of 2019 as an effort to explain and explore climate change as a significant threat to health and health equity. And that was an effort spearheaded by our sustainability committee here at the Eccles Sciences Library. And since its inception, the Eccles Health Sciences Library has hosted nearly 20 lecture presentations spanning several topics, including eco-anxiety, the incoming inland port, and vulnerable populations to climate change crises, including low-income and unsheltered folks. And so we are so excited and honored to have Piper Christian here with us today, who's going to be sharing about her research over the past couple of years, studying air pollution and dust pollution here in the Salt Lake Valley. But I'll go ahead and introduce Piper, and then I'll turn the time over to her so that she can continue to share some of the great work she's been engaged in. So Piper Christian has graduated from the University of Utah in 2022, earning a Bachelor's of Science in Environmental and Sustainability Studies with an emphasis in air, water, and health. In 2022, Piper served as the project lead for a team of NASA researchers, where she studied how dust from the drying Great Salt Lake would exacerbate existing pollution inequities within Utah. Her research in college focused on how key stakeholders can better support Utah families with asthmatic children who are impacted by air pollution. From 2022 to 2023, she worked with the SPARC Environmental Justice Lab at the University of Utah, where she served as the liaison between students and community partners for environmental justice research relating to air quality. Through these partnerships, she helped provide 50 low-cost air purifiers to community members, helped oversee an air filter exchange program, and conducted air quality lessons at local schools. Piper is also a great friend of our library. She's been really critical in helping us improve indoor air quality and participate in undergraduate research that way. So again, we're really grateful to have her with us. But with that, I'll turn the time over to you, Piper.
Thank you so much for having me, Joy. And it's so great to see some familiar faces on here. I'm going to quickly do share screen. There we go. Okay, awesome. Well, thank you, everyone. I have a bit of a problem with rambling, so I'm going to make sure my clock is nearby, my phone. So yeah, today I'll be speaking about air quality and environmental justice in Salt Lake County from the various projects I've been involved in, specifically lessons learned from researching local pollution through NASA and the University of Utah. So first, a little bit about me. Joy already gave a great, thorough introduction, but I was born and raised in Logan, Utah, and growing up, my first exposure to air pollution issues was being held inside from recess because the particulate matter was too high during inversion events. And so I remember from a young age being really interested in this issue. I graduated from the University of Utah in 2022, and in addition to receiving my major in environmental sustainability studies, I got a certificate in GIS, which focuses on mapping. And the reason for that is that I'm interested in how mapping can be used to better understand and address environmental injustice. And I am currently working for the NASA Develop program, which I will share a bit more about shortly. So first, I want to explain why I'm interested in mapping as a tool for understanding environmental injustice. So my freshman year of college, Dr. Robert Bullard, who is considered a real, some have called him the father of environmental justice. He was a major leader in the civil rights movement as well. But he came and spoke at the University of Utah, and his story I found really inspiring. So in 1978, his wife filed a lawsuit against a company that was planning to put a landfill in a Black middle-class community in Houston. And she teamed up with him as a sociology researcher, and his students did a project where they mapped where the landfills were located across Houston. And this map can be seen on the right in 1979. And they found that 5 out of the 5 landfills in Houston were located in Black neighborhoods, and 6 out of the 8 incinerators were in Black neighborhoods. And this ended up, the mapping that they produced and the data that they produced ended up leading to this being the first lawsuit which used the Civil Rights Act to challenge environmental discrimination. And they were successful in blocking the siting of landfill. And as I was sitting in that lecture, I was thinking about you know, what I have seen living in Salt Lake City and the disparities in pollution exposure, and realized that mapping could be a really valuable tool for talking about and looking at these issues. Unfortunately, we'd like to, you know, these communities know what they're experiencing, and it would be ideal to be in a world where we could just, you know, take what they have to say and enact policy. But unfortunately, data is often a piece that that is demanded, and so this can be a useful tool. So next, I think it's important to understand the context of environmental discrimination and racism in Salt Lake City. So, I think a really important way to understand it is through the practices of redlining that occurred in the 1930s. So under redlining, mortgage owners like the Homeowners Loan Corporation, which was government backed, would rate neighborhoods on a spectrum from desirable to hazardous. So you can see in this map that neighborhoods like Yalecrest or neighborhoods where the University of Utah resides were the top neighborhoods to live in. And as you move west, they then were decreased in value. And there are stories of for example, there was I read an article in the Salt Lake Tribune of a World War II veteran who was Hispanic and applied to live in the Marmalade, or I believe it was one of the yellow, like Capitol Hill neighborhoods. He had the funding and money to pay for his mortgage and was denied because it was a neighborhood that was reserved for white residents. So this was used as a tool for segregation to keep people of color from buying and paying for homes across Salt Lake. And those legacies are still present today. So what we see is that because of that, the West Side had less home ownership and more transient rental populations, which made it very vulnerable to the siting of point source pollutants. So we notice that there is more industrial activity, you know, the expansion of the interstate, et cetera, on the West Side. And this is really in part from the legacy of these redlining practices. And so, as I mentioned, so now we see presently that there's an inequitable distribution of pollution exposure in Salt Lake County. So there's a variety of point source pollutants on Salt Lake City's west side. And specifically, my honors thesis advisor, Dr. Graneski, looks a lot at these kind of the distribution of exposure across the city. In one study, she found that schools with higher proportions of racial and ethnic minority students were unequally exposed under all PM2.5 pollution scenarios, reflecting the robustness of racial and ethnic disparities in exposure. So we see these legacies still present today in Salt Lake City. And broadly speaking, this pollution exposure has impacts across the county as well. So Utah typically experiences 18 days with high PM2.5 levels exceeding the national ambient air quality standards. So these are thresholds where the EPA determines if a city is within attainment or non-attainment. And so basically it's showing that we have unsafe levels for public health. Our wintertime inversions are linked to increased asthma emergency department visits. And now we have all sorts of new things to enjoy, such as the wildfire season, and also airborne dust, which is present from the Great Salt Lake and other sources. And these are presenting additional health hazards. I recall talking to some friends through the NASA program who are from out of state. And as we were mapping air pollution, we had to figure out which pollution season to focus on, because they were like, oh, what about August and September? And I was, no, that's wildfire. And then January and February, that's inversions. It was pretty troubling to think about. We have these different pollution periods throughout the year. And now we're facing yet another threat to public health through the declining levels of the Great Salt Lake. So what we know is that over 50% of the lake bed, or playa, has been exposed as of November 2022. And we do know that we had an excellent snow season this winter, but while lake levels have risen, it is insufficient to curb dust emissions, and it may not be maintained long-term. So what we saw this winter was that the efforts to save the Great Salt Lake were slowed in the state legislature because we had a good water year. And that's really not a good way to think about this, because in the long term, we can't rely off these El Nino or La Nina weather seasons to sustain the Great Salt Lake. Ultimately, we are withdrawing more than we are putting in. So it's important to know that the Eastern Great Basin naturally experiences seasonal dust storms. So for folks who've lived in Salt Lake for a long time, dust is not a brand new thing in the valley, but these storms may grow in frequency and intensity as more of the lake bed becomes exposed and that dust is available to be picked up by the wind. And what has raised quite a bit of alarm is that trace metal dust content that is deposited along the Wasatch Front has exceeded EPA regulatory limits previously. So what we are witnessing here is that there is this legacy of intense mining activity around northern Utah and the Salt Lake Valley. And for a long time, before regulatory limits were set, many of those trace metals were dumped into watersheds or stored in certain locations through various Superfund sites. And so as the lake level declines, we're starting to see some of those trace metals become exposed. But one thing that's really important to note, that regardless of the content of the dust that's in the lake bed, dust is inherently, it's health harming. So whether it's whatever kind of particulate matter it is, simply by inhaling small particles, we know that it is not good for our health. So along that line of thinking, I wanted to kind of share some definitions, because when I'm talking about the research, it'll be helpful for understanding what we were studying. So the first thing that's good to know is that PM 2.5 pollution is a serious health concern worldwide. And what you can see on the right, I think, is a diagram that maybe some of you have seen before. So we see a human hair and a grain of sand. So you can fit 5 PM10 particles across the width of a human hair. And you can fit 4 of those PM 2.5 particles across the width of a PM10 particle. And so the reason why this is of great concern is that these particles are able to go bypass the body's systems, like the hairs in your nose, etc. And it gets into the lungs and can really cause a lot of long-term health impacts. So it's associated with eye, nose, and throat and lung irritation, asthma attacks, acute or chronic bronchitis, and heart and lung deterioration. And we also were looking at ground level ozone, which is considered another criteria pollutant. So the EPA has 6 criteria pollutants that they track that they consider health harming. And it can damage the tissue of the respiratory tract, cause inflammation and irritation, and worsen asthma symptoms. So what you'll see later on is that through our NASA research, we were looking at something called aerosol optical depth, which abbreviated to AOD, and that was used as a proxy for PM 2.5. It's basically a way that the satellites measure particulate matter pollution. And then additionally, we looked at nitrogen dioxide and formaldehyde as these are precursors to ground level ozone. So we will share about that a little bit more. So with all of that background, this is kind of the story of the research that we did this spring through the NASA Develop program.
You put me on hold.
So our program was called Great Salt Lake Health and Air Quality, and we were specifically monitoring lake bed exposure and its impact on air quality and environmental hazards in the Great Salt Lake watershed. So first, a little bit of background about the NASA Develop program. So the NASA Develop program is a subsection of NASA. And so frequently people would think, you know, I know probably less about space than the average person. That's not really my area, but this is specifically how NASA uses satellite imagery to solve environmental issues and address environmental questions. So that's kind of the little sliver of NASA that we were located within. So the NASA Develop program works with communities and organizations to address environmental and policy concerns through the practical application of NASA Earth science information. So this was a 10-week term, and it was a 10-week-long research project, and I was on an interdisciplinary team of 4 people. So I served as the team lead, and then I had 3 co-researchers with me. And the research teams work with end users, and these can include federal agencies, state and local governments, nonprofits, for-profits, and others. And what we do is we assess how Earth observation data can inform decisions and actions. So a community organization or a state agency may approach NASA and say, we have this environmental problem. Could you utilize satellite data to help us better understand it? And then this team is deployed to research it. So for our project specifically, we had a lot of project partners, which was a really rewarding experience. So first, from state government, we had the Utah Department of Environmental Quality, Division of Air Quality, the Utah Department of Natural Resources, Division of Forestry, Fires, and State Lands. That one might, you know, be a little bit confusing for some. So this is the area, the department that is, or division that's responsible for lake bed management. So that was their investment, was understanding how the lake is impacting air quality. On the academic side, we worked with the Great Salt Lake Institute from Westminster College, and an organization led by Dr. Maura Honnenberger from Salt Lake Community College called Dust Squared. So this is a research team that's looking at dust across the urban interface. And then from the nonprofit sector, we worked with the Great Salt Lake Coalition, which is a coalition of organizations that are all working on Great Salt Lake advocacy and protection, Utah Physicians for a Healthy Environment. And then our local organization was Westside Coalition, which is a representative body of the 6 neighborhoods on the west side of Salt Lake City. Our study area and period. So we were specifically looking at the Great Salt Lake watershed. And so this included the counties Box Elder, Cache, Rich, Weber, Tooele, Davis, Morgan, Salt Lake, Summit, Utah, and Wasatch counties. So you can see this on the map up above. The purple is what the areas that we were focusing on. This is the most populous region of Utah, as I'm sure you all know. There's roughly 2.5 million people who live in this region. And our study area was from 2010 to 2022. Now, sometimes people, that can kind of cause confusion. Why did we pick that study period? Something that we wanted to avoid when we were studying the Great Salt Lake desiccation or lake level decline is that often people, when they think about the lake declining, they compare current lake levels to the lake levels in 1987, 89. That's when the Great Salt Lake was significantly flooded. So that time was not necessarily representative of the natural lake level. And so we thought that this period kind of captured, would capture the lake level and still show some different like increases and decreases over time without having major anomalies. So the first thing that a Develop team does when we begin a research project is we meet with our various community partners and we try to get an understanding of what their core concerns are so that we can match our project and deliverables to their needs. And these were kind of the most salient issues that these communities shared. First, they were worried about the legacy of redlining and how it resulted in inequitable pollution exposure. So they wanted to see, can we show an association between the neighborhoods that have been historically redlined are the ones that are bearing the brunt of the burden of pollution? The next thing was industrial air pollution. So a major concern that came up was they said, while the Great Salt Lake decline and the dust is very worrisome, we have been experiencing unsafe levels of air pollution for decades that have not yet been addressed. For example, our partner, Terry Marasco, talked about how the tailings piles from Kennecott Copper blow dust off of them regularly, which is deposited near and on their communities. So he said dust is something that we have suffered from and experienced for a long time. And so it's important to understand the way that dust from the Great Salt Lake may be just exacerbating these existing pollution exposures. And then finally, they were worried about the Great Salt Lake, specifically how it might worsen these present health disparities. Broadly speaking, the three primary priorities were public health, climate change, because we see that climate impacts the lake levels, and then finally, how in turn that leads to poor air quality. So with that in mind, we crafted our core objectives. So the first was that we wanted to map regional dust and air quality indices. So we wanted to use satellite data to show how pollution is distributed across our study area. Next, we wanted to map regional dust and air quality vulnerability. So what we mean by that when we say vulnerability is that we take our pollution data, just the raw concentrations of pollution, but then we wanted to add on to that census tract or neighborhood level data from the US Census Bureau on race, income, age, other demographic variables, so we can see how pollution and sociodemographic variables might interact. Who is getting the most exposed to this pollution? And then we wanted to understand the relationship between lake bed exposure and air quality. So we wanted to see if our satellite data could be used to show that as the lake shrinks, air pollution gets worse. And finally, kind of the core part of the DEVELOP program is to produce impactful visual and storytelling materials. The idea is that we can make science accessible for community partners so that they can use it for smart interventions. So these were the different satellites and software that we used. And so the first was the Landsat 5, 7, and 8. So this one was used to study lake surface area. The Terra and Aqua Modus satellites, these ones were used, so you'll see again this term aerosol optical depth, AOD. So what's important to remember is that was what we used as a proxy for dust pollution. And then we used Sentinel-5 Tropomi, and this satellite was used for tracking nitrogen dioxide, formaldehyde, and carbon monoxide. Carbon monoxide, I won't go into great detail on that. That was mostly used to filter out wildfire smoke. So we wanted to make sure that what we were looking at was dust and not smoke from seasonal wildfires. And then lastly, we used Calypso to understand so first, Terra and Aqua Modus show us yes or no, is there pollution? And then Calypso comes in and tells us, okay, if there is pollution, what type of pollution are we looking at? What kind of dust are we seeing? And where is it located in the atmosphere? Because we know that if it's closer to the ground, it's more health harming. So those were the satellites and data that we used. So in terms of our findings, the first was that there's an inverse relationship between lake surface area and dust levels. So what that means is that as the lake shrinks, the dust gets worse. So this was what we suspected, and it was, confirmed by previous research studies. But what was novel about this was that we were showing it with satellite data, because the nice thing is that ground level sensors, for example, air quality monitors or lake gauge stations are very expensive, and they're not always evenly distributed. So what we were hoping is that if we could use satellite data to show these environmental phenomena, that can really have a lot of potential for studying environmental issues that are in places that maybe don't have access to traditional monitoring equipment. So you can see here on the left, so this is lake surface area in blue, and then the red is the dust levels. When we say MAM, that stands for March, April, May. This is the period of the year that usually has the highest dust levels. And so that's why we were using that. Our second finding, and I recognize I personally found the figure below pretty intimidating when my team partner produced it, so I'll kind of go through the details of it. But basically what we found from our Calypso data was that certain dust events demonstrated an aerosol subtype primarily composed of polluted dust. So you can see that there are these classifications on the right-hand side. And then you can see in brown, this is when the satellite went over, it's classifying the types of dust. And we saw that it's polluted dust, which is of concern because of its potential for harm to public health. Additionally, we found that the pollution is located near the surface in the troposphere, the surface of the Earth, and this is also of concern for public health. So there's dust present, it's near the surface it's near the ground, and it's polluted. And then this was the part of the project that I was particularly excited about because I got to use my GIS background to map the distribution of air pollution across our study area. So first, as I had previously mentioned, we used formaldehyde and nitrogen dioxide because these are associated with ground level ozone, and ground level ozone has impacts on health. So that's why we were looking at these two. And what you can see between both is that there is high concentrations along the I-15 corridor. And this is not surprising because these pollutants, particularly nitrogen dioxide, comes a lot from internal combustion and vehicle emissions. So folks who are living along I-15 have elevated risk to these pollutants and exposure. And then our next one, which I think was the main focus of our study, was dust. How is dust distributed across our study area? And so we saw, you can see that on the western side of Utah, there's elevated dust levels. And this isn't very surprising just because of the wind patterns that are blowing dust off both the Great Salt Lake Playa and other surrounding areas, deserts. And we also see high dust levels along the I-15 corridor, likely again from cars stirring up dust. So what we see is on the I-15 corridor, that's likely not from the Great Salt Lake, just because it's very possible that it's coming from, the interstate itself, but still definitely a concern for human health and exposure. So this is kind of the part, mapping wise, that was really the crux of what we were working towards, was then taking demographic data and overlaying it to show areas that are particularly vulnerable to air pollution. So what this process looks like is we started by talking to our partners about what sociodemographic variables should we consider in our vulnerability analysis. What things may increase a person's vulnerability to air pollution in your community. And some of the major things they listed was income, race, and age. So younger folks under 5 or over 65 might have higher vulnerability physically to air pollution. And then the role that race and income play is that when you're exposed to air pollution, how might the impacts of racism or or your income affect your ability to access healthcare, or how policymakers might respond to you when you ask for better protections, or your ability to leave your neighborhood or move away. So that's why we were looking at these variables for understanding pollution vulnerability. So you can see here, what we did was aggregate these to make a single social vulnerability index across Utah. And what you can see is that, again, following kind of the history of redlining along the I-15 corridor and on Salt Lake City's west side, these were the areas that have higher vulnerability. And then at last, we were able to produce our our pollution vulnerability maps. So unfortunately, through NASA, we're limited in which maps we can share because there's a pretty stringent process of export control. So this was the one map I was able to get clearance to share. So this is looking at dust vulnerability in Utah. So what you'll see is that the pink on this key is our social vulnerability. So low vulnerability to high vulnerability. And then the blue is our mean aerosol optical depth, so that's dust. So what we're doing, this is called a bivariate choropleth map. And you can see in this key, we're looking at how these two variables compound upon each other. So the areas that are in dark blue are where there is both high social vulnerability and high dust exposure. So these are the areas that we're hoping to use this map to show these are the places where we should prioritize interventions. And just for reference, some of you may have heard of the EPA Environmental Protection Agency Environmental Justice Screen. So they will map, various indicators of kind of similar to this, different environmental justice indicators, how they're distributed across the city, and they use similar methods for understanding the distribution of different injustices and exposures. Oh, wait, before I move on. So ultimately, I think what is most evident of this, from this, is that what we saw is that the dark blue regions match very closely with the redlining maps that we saw at the beginning of this presentation. And this is what a big piece of what the partners were interested in knowing. It confirms these concerns that the legacies of these racist policies back in the 1930s are still being felt by residents in Salt Lake City today. The main thing that we were excited to see was that Earth observations can be used to better understand dust, air quality, lake bed exposure, and community vulnerability, and that satellite imagery may fill present gaps in air quality monitoring networks. And before I talk about the San Joaquin Valley, I do want to go over kind of the takeaways in greater detail from our project. Oh, wait, never mind. This is actually more broadly speaking. So again, just wanting to reiterate from this map. So we produced similar maps for nitrogen dioxide and formaldehyde and dust. Those were the three that we made. And the goal of these now is that we share these with both state agencies and our community partners. And their intention, as they have shared, is that they want to use this to raise a lot of attention to the environmental racism that's present in Salt Lake County, and to hopefully use these to inform interventions to protect public health, particularly on the west side of Salt Lake City. And for the state agencies, they're interested in using these maps to cite new air quality monitors to gather further data. Not affiliated with NASA, I would love to see even more than that be done. And potentially just inform new interventions on the west side of Salt Lake, and also to help with lake bed management practices and air quality regulations and more. So we're hopeful that what we've revealed through these maps, which really confirms what these communities have been saying for a long time, will be actually utilized and to create some change. So returning to kind of what the future work is, one thing that's exciting about this pilot study is that we are now replicating the methodology that we used this spring for a different project in the San Joaquin Valley of California. So as a little bit of background, the San Joaquin Valley is responsible for 25% of the US crop supply in the US. Because of climate change, crops have been dying off, and this results in the need for agricultural burning. And so what we're looking at this summer is the way that various pollutants, including this agricultural burning, is impacting public health. So the San Joaquin Valley has some of the highest childhood asthma rates in the country. It's also a very diverse area of California, and it has a large immigrant labor force working in the farms in that area. And so what we're doing is using the methodology we used this spring to now better understand pollution exposure and inequities in this other part of the country. And the goal is to use that to advocate to the California Air Resources Board to better regulate agricultural burning in the area. So that is really, I think, what is useful about DEVELOP is that we really want to create replicable processes that then our community partners and other scientists can use to apply elsewhere. And then in terms of takeaways, there were a lot of big things that we learned from doing this work. Some of the big ones were that science, especially working with community partners, should be an iterative process where we're producing maps and figures that we know are useful and understandable for our community partners. So for example, in our vulnerability maps, feedback that we received was that we don't know what we're looking at. Like there's not any waypoints such as like major interstates or the airport or other things so that we know when you have a census tract that is purple that shows high pollution exposure, how do I know that that's whether or not that's my neighborhood? So what we've done is we're continuing to edit those maps so that we can add some things to help our community partners orient and understand what they're looking at. A really valid concern for them. Additionally, it's important to be adaptable as priorities and needs change. So throughout the process, we would receive feedback and be kind of redirecting our efforts to make sure what we produced is still matching their needs. And then I think a big thing is to recognize the knowledge of those living in the areas you study. So as I said earlier, our research is often simply confirming what the residents already know. So I think it's important to, if you're working with these communities, to have a lot of humility that they are the experts. We are just here to provide support, and because often they can provide a lot of great insight on things that we might be missing. And additionally, I think the biggest thing is that while these maps and figures are useful and were requested by these partners, data on its own only is revealing the problem, and that is not sufficient. So what we hope is that this data can then be used to craft really targeted solutions. So I recognize I have about 5 minutes remaining, but I wanted to end on kind of a positive note because outside of working with the NASA DEVELOP program, I have been working with the SPARC Environmental Justice Lab under Dr. Adrienne Cashlin. And it was fun to work on these things simultaneously because we were producing these kind of depressing maps. And then at the same time, through the SPARC Environmental Justice Lab, we were getting to work with community partners on crafting some short-term interventions to help community members, cope with air pollution exposure. And just a little bit of background, the SPARC Environmental Justice Lab is composed of a lot of different professors across campus, and they're open to new professors joining. And it's really the goal of promoting action-based research where students and community partners can collaborate specifically on environmental justice issues. So as Joy mentioned in the introduction, some of the interventions that we've been working on in partnership with the Glendale Library, the West Side Coalition, Representative Angela Romero, and others, is that trying to find some ways, as we work towards these long-term policy changes to reduce air pollution, what are some short-term interventions that people can use to protect their health in the interim? And so one that's been really exciting is these do-it-yourself air purifiers. They are comparable in efficiency to commercial grade air purifiers and cost about $60 to produce compared to commercial ones, which are often in the range of hundreds of dollars. And so far we have built 50 at the Breathe Clean Festival, with Youth City, and with a 7th grade health class at Glendale Middle School. So it's been a great opportunity to learn from the community and partner with folks and talk to students and community members about air quality. Briefly, we have been doing air quality lessons in middle schools across Salt Lake Valley. So here's one of our students, they love the smoke machine, talking to students about particulate matter and how air quality sensors track it. So this is a great way to kind of increase literacy about pollution exposure and measures to protect your health. Clean air spaces. So some may not know, but the Eccles Health Sciences Library has some commercial grade industrial grade air purifiers. And this is behind the idea of having designated public spaces where people can go for refuge during wildfire smoke events or other pollution events. By no means a perfect solution, but in terms of thinking about climate resilience, these might be the kind of things that are good interventions for cities to consider. And then lastly, something I'm really proud of that I've worked on this spring in partnership with Dr. Cashlin and Dr. Daniel Mendoza is an air filter exchange program. So we exchanged furnace filters in 11 homes in Glendale and Poplar Grove this spring. And what we did was record air quality before and after the filter exchange. So we're putting in high quality air filters in these homes because that can improve air quality across homes. And we interviewed families about their indoor and outdoor air quality concerns. And the intention of this program, this was just a pilot project because we only had 11 families, is that we'd like to scale it up into a larger research study because indoor air quality is a really good opportunity for some great interventions in Salt Lake County, where people spend a lot of time inside. And so we can start by, doing measures to protect folks' health in their homes. And we'd like to use it to advocate for a filter exchange program across the West Side eventually. And then I don't think I have time for this, but those things, are important, but they're short-term interventions. And I always think it's important to keep the focus on policy change. Like the people who are responsible for creating this mess should also be responsible for fixing it, not just the communities who bear the brunt of this burden having to, protect their public health on their own. And so through my honors thesis work, I interviewed families who had children with asthma about the recommendations they had for policymakers, healthcare providers, and schools, and then shared their recommendations with stakeholders around Utah to talk about, directly from the people who are most impacted, this is what they want you to do to protect their health. So I won't get into it, but these are the different handouts that I made for our various stakeholders. And share them with policymakers and school boards and things like that. And then finally, lessons learned, 1 minute remaining. I think the biggest things from this work, I'm by no means an expert. I think I've like fallen on my face plenty of times doing this and learned and always open to feedback. But I think some of the biggest things have been the importance of allowing time for relationship and trust building. In environmental health work, I think it's so crucial that if you're identifying a problem, you also talk about the path to a solution as well. I think it can be really harmful for researchers to go into communities, generate all this data on how many health harming pollution exposures they're experiencing and then just leave. I think that's really irresponsible. So it's important that when we talk about the problems, we also work with folks to talk about what we're going to do about them to improve health. And then it's important to build your research around the community's interests and needs and not the other way around. And then lastly, ensure that your work is mutually beneficial. So we made sure that Our partners received credit for their contributions to our work and our research, and that everything that we produce is usable to them. And we've produced tutorials and materials so that they can replicate our work if that is of interest to them, so that there's skill sharing and resource sharing throughout. I believe. Oh, and lastly, acknowledgements. Special thanks to Maria, Joanna, and Fiona from my research team, and Julianne Liu, who was our NASA fellow, Dr. Kashlin and Dr. Mendoza from the SPARC Lab, and Dr. Graneski, and now Dr. Mullen. She just received her doctorate. The University of Utah has a really outstanding community that's working on air pollution, and none of this could have been done without them. And then lastly, our community partners, NeighborWorks Salt Lake, Glendale Middle School, Glendale Library, Westside Coalition, and the Westside Community Councils. They are really at the core of everything that we're doing. So with that, I think we can turn it over to questions.
Thank you, Piper. Yes, folks, feel free to enter any questions you may have in the chat at this time. And then I also just allowed everyone to unmute themselves again. But I do have a question for you, Piper. So you mentioned, we know that the Great Salt Lake is shrinking, increased dust particles, but we also know that on the west side, there is a lot of efforts by local legislature and a lot of real estate developers to continue developing and building new projects and utilizing the west side of the valley for various things. Have you noticed in this research or your communication with community partners any sort of hesitation or any sense of pause on those projects in relation to the dust pollutants increasing, or has that been a problem for the development that is rapidly happening out on the west side?
Great question. So are you kind of talking about like what concerns have they shared in terms of how these things?
Right. Have they recognized that it is a concern? Is that something that they're worried about? Or is this all, we had, like you mentioned earlier, we had such great precipitation levels this year. So people are just kind of brushing it under the rug.
Yeah, I think there is a lot of, I think, pretty well-founded distrust from these communities, especially of policymakers, just because they've been so consistently disenfranchised by the legislature. And I think that it's important to recognize that we had partners with state agencies and with community partners. And I think, this work is complicated and challenging and sometimes not always clear, so it was talking to some of the community partners who were like, we don't necessarily need more data. Like if the solution is like them just doing more research studies to tell us how bad it is, like that's not sufficient. And I think that's just something that as researchers, needs to be considered and thought about. And I definitely had some ambivalence grappling with on this project. I think it's why simultaneously we were working so much on talking about solutions and interventions. And yeah, I think there's a lot of frustration with the I-15 corridor expansion, the inland port, and then on top of that, the Great Salt Lake. So as we were interviewing families, especially for the air filter exchange program, for sure, they were talking about, they are very well versed, I think, on what is going on, and a lot of frustration about the lack of action to stop it.
Thank you, Piper. I'll go ahead and read Joan's question from the chat. So Joan says, great presentation, Piper. Thank you. How far have your results now been communicated?
Awesome question. So at the end of our project, we did a closeout presentation and then a public presentation for our we had one presentation that was open to the public, and the maps and figures that I used in today's lecture are all from the public presentation. And then we showed all of our maps and figures only to our community partners. The reason for that is just because of some clearance processes at NASA. So the full package of what we produced has not yet been gone through export control. And so it's looking like sometime this summer, all of those materials will be approved. And that's when we can really spread the word more broadly about our findings. So we've had press reach out to us specifically, Heal Utah, the Great Salt Lake Coalition, West Side Coalition, they are really interested in really being out and loud about these findings and drawing attention to what they kind of confirmed that the communities already knew.
Piper, it looks like we have some folks who want to connect with you. So if you'll go ahead and just leave your contact information for folks also. This session was recorded or is being recorded. So the recording will be on our webpage and our YouTube channel. And then I'll also, whatever Piper can share in terms of slides and additional information will also be posted on our website. But yes, please feel free to connect with Piper. Any final questions for our amazing presenter? Okay, I'm going to take that as there are no more questions. Piper's given you her contact information, so if there is anything that comes up or if you do want to further collaborate, please do connect with her. She's an excellent resource, as you can see from her presentation today. But thank you all for joining us. We appreciate it. And like I said, the recording and the slides, if we are able to, will be posted on our webpage. So thank you all for joining us.